Welcome to Frederick at its best. I'm Frederick County Executive Jan Gardner. October is Breast Cancer Awareness Month, and I heard this morning on the radio that it's also being referred to as Pinktober. Breast cancer and other cancers can affect everyone, regardless of age, race, or gender. Today we gather together to raise awareness about breast cancer and to focus on the importance of early detection. Millions of women are surviving breast cancer. Their survival rate has improved thanks to dramatic leaps in cancer research, including some research that is happening right here in Frederick County. Another major reason we are seeing people survive breast cancer at a higher rate is thanks to the tireless advocacy of the American Cancer Society. The nonprofit educates the public about the need for routine testing, and they have invested billions of dollars in cancer research since 1946. Early diagnosis and better treatments are making a difference. We know that women whose mother, sister, or daughter has been diagnosed with breast cancer are twice as likely to develop the disease. But many people don't realize that more than 85% of women with breast cancer have absolutely no family history. 1 in every 8 women in the United States will be diagnosed with breast cancer during their lifetime, about 12% of all females, according to the American Cancer Society. It is the second leading cause of death in women after lung cancer. The organization estimates that 268,000 new cases of invasive breast cancer will be diagnosed in American women this year, and unfortunately, nearly 42,000 women are expected to succumb to the disease. The good news is that there are more than 3 million breast cancer survivors in the United States today, and that's a lot of people. It is crucial that all women conduct self-examinations and that women over the age of 40 get a mammogram annually. Men can also develop invasive breast cancer, so everyone should see a doctor if they notice a suspicious lump in their breast. There is no sure way to prevent breast cancer. Some risks, such as family history, cannot be changed, but there are lifestyle changes that can lower your risk. Breast cancer prevention starts with healthy habits. Strong evidence suggests that physical activity reduces the risk of several kinds of cancer, including breast and colon cancer, according to the Centers for Disease Control and Prevention. The Frederick County Health Department's Breast and Cervical Cancer Program offers clinical breast exams, mammograms, and pap smears at no cost to eligible women. Diagnosis and treatment services are also available. To see if you qualify for this program, call 301-600-3362. And again, that's 301-600-3362. Breast Cancer Awareness Month is a good time to learn more. Learn how to prevent and detect cancer and learn about the resources that are available in our community. And certainly if you're listening to this, go out and get your mammogram if you haven't done so already. So I would like to take a moment to read a proclamation. Whereas breast cancer is the most commonly diagnosed cancer and the second leading cause of cancer death in American women, every woman is at risk for breast cancer, even if she has no family history or other risk factors for the disease. And men can also be at risk for breast cancer. And whereas screening and early detection of breast cancer is essential to the well-being and health of women, the Frederick County Health Department's Breast and Cervical Cancer Program offers clinical breast exams, cervical cancer screening, and mammograms. And whereas research shows that screening mammography can help to reduce the number of deaths from breast cancer among women, and whereas Frederick County encourages women to learn about their risk for breast cancer, to talk to their health care providers about recommended breast cancer screenings, and to undergo clinical breast exams and mammograms as appropriate. So now, therefore, as the County Executive of Frederick County, Maryland, I hereby proclaim October 2019 as Breast Cancer Awareness Month in Frederick County, also known as Pinktober, and commend this observance to all of our citizens. So with that, I'm going to pass the microphone to the people who've joined me for their comments.
Good morning, and thank you, County Executive, for the opportunity to be here this morning in observance of October, or Pinktober, being Breast Cancer Awareness Month. My name is Beth Mowry. I work at the Frederick County Health Department's breast and cervical cancer program. So we just want to get the word out to women who are out there that don't have resources such as health insurance and need to get screened for breast cancer. Please contact our program and we will be happy to assist you further. And that number again is 301-600-3362. Thank you.
Hi, I'm Avnisha. I'm the Community Health Educator for Cancer Screening Program at Frederick County Health Department. I'll just like to say that all women are at risk of getting breast cancer even without having family history. So I'll just like to recommend all women who are 40 years and older to get their mammogram screening even if you do not have any symptoms. And as Beth and County Executive said, we have this program where we offer clinical breast exam, PAP, and mammogram for no cost to women who meet our eligibility requirement. Thank you.
Thank you, County Executive. My name is Mariam Dobson. I'm the Director of Community Health Services at the Frederick County Health Department, and in that capacity, I support the work that Beth and Avni do every day to work with women to help screen early to prevent cancer occurrence. As the daughter of a breast cancer survivor, I do want to applaud the work that everyone does in Frederick County to screen, to prevent, to educate, and to also treat when there is a diagnosis of cancer. Thank you all.
Thank you very much. My name is Mary Ellen Hackett, and I'm with the Frederick National Lab for Cancer Research. We're proud to be a member of the Cancer Coalition and to be conducting the kind of research that will hopefully at some point contribute to additional treatments for breast cancer and other cancers. Thank you.
Good morning. My name is Cathy Duncan. I am a 7-year ovarian cancer survivor and also a member of the Cancer Coalition. My mother had breast cancer and my grandfather had colon cancer, and I never realized that there could be a link between breast cancer, colon cancer, and ovarian cancer. So I saw my doctor and I talked about my family history and I was referred for genetic testing. So I just would encourage women that have breast cancer or ovarian cancer to talk to your doctor about your history because you too may be a candidate for genetic testing.
Hi, good morning. Thank you very much. My name is Lakshman Bindle, and I work at Frederick National Cancer Institute, and I've been a cancer research scientist for over 10 years. And it's my colleague and I, we are here to help anyone who's having cancer or who may be one day diagnosed by cancer. All these cancer treatment medicines or the research has come through is from starting from a lab like ours. And I really appreciate the Frederick County and America to give us the support to do these small researches. And many of our research are accumulative of the clinical studies, and personally this has touched me because I have friends and family who are survivors of the breast cancer, and so I really appreciate to give me a chance here, and the Frederick County, and on behalf of National Cancer Institute, I thank the Frederick County and America for giving us the support to work in the lab like us. Thank you.
Thank you very much. Thanks to all of you for joining us today to help raise awareness about breast cancer. Prevention and early detection are key. You can contact the Frederick County Health Department or the American Cancer Society for more information. I want to thank the Cancer Coalition for all their good work. They are certainly coordinated through our health department and do a lot in the fight against cancer in our community. I want to thank our researchers for the good work that they're doing to find the cure for cancer. We really hope that that happens in our lifetime and that we can make sure that more people can survive this terrible disease. Certainly, the American Cancer Society does an outstanding job providing education, information, and referrals, support groups, and other services. A lot of organizations in our county are involved in October in raising awareness. One of them that I'd like to recognize is the Hurwitz Breast Cancer Fund, established at Frederick Memorial Hospital by residents Jeff and Patty Hurwitz. Contributions to the fund have really helped to make a difference and to save lives in Frederick County. There are other partners, including the Face Striders with founder Angela Spencer, who also do a lot to bring awareness to breast cancer. You don't have to be part of an organization to bring that awareness. I know one of my friends put out on Facebook today that she's a 3-year survivor of breast cancer, and that she encouraged people to go out and get their screenings and do what they're supposed to do for early detection. So every individual person out there can try to encourage this through their own connection of friends and family. So I certainly commend everyone that is here for their collaborative efforts throughout our community. The message today is to be vigilant about breast cancer detection. If women or men notice any changes, such as a new lump or changes in the skin, they should immediately consult with their doctor or healthcare provider. My hope is that we will find that cure for cancer. Today's ceremony helps us all to be more aware and to do all we can to prevent and detect breast cancer. So thank you for joining us for Frederick at its best.